IVF Day. IVF, in vitro fertilization, and this is a procedure that is increasingly being adopted by couples and women worldwide because people are choosing to have babies at an increasingly advanced age nowadays. IVF is a procedure that is increasingly helpful if people want to freeze their eggs, if they have prioritized their careers at a certain stage and they want to have babies later, for athletes and others. Now, while IVF is increasingly popular and this is the 41st anniversary of the birth of the first IVF baby, there are still a lot of questions in people's minds. For instance, when do you decide that you have to go in for IVF treatment? What kind of a specialist should you go to? Are there different kinds of specialists? Do you have to choose? How long does the procedure take? What are the expenses involved? Are there any side effects? So these are questions that play on people's minds if they are deciding to freeze their eggs or if they are deciding to go in for IVF treatment. So today, as we are celebrating IVF Day, RevSportz is speaking to a couple of specialists who are answering these questions to us. So do please listen in.
Hello and welcome to another special interview on the occasion of IVF Day, and joining me is Dr. Priya Khamatkar. There are a lot of misconceptions about IVF, a lot of apprehensions about IVF. Still, frankly, there is not enough information available in the public domain for people to get enough and more confidence for ordinary people and also athletes to be able to go in to get the procedure done. So that is why this interview will clarify quite a few of our doubts. Dr. Priya, the first question that I wanted to ask you is, how does one realize when they need to go in for IVF?
See, basically, whenever a person is planning for pregnancy, they go through with the first normal concept that comes to a person's mind is like, we have to try naturally. They try naturally. When that's not working out, they go and approach for treatment, like what should be done correctly so that we can achieve the desired result. In that case, when we find that there is certain problem which can be corrected only by certain techniques, that is when we realize that yes, this is a couple who may need an IVF. So what are these conditions that we see? First and foremost, it is the tubal factor. If at all the tubes are having a problem, where we consider that IVF can be a solution for them. Suppose it's some hormonal issue in the person which can be corrected only and once we do an IVF for them, that is the condition where we feel that yes, IVF is needed. We also see for the duration that the couple is trying and it's not working out for them. We also see whether there is any other unexplained reason, like in spite of trying everything is normal, but still things are not working out. IVF is one thing that comes to our rescue, and yes, such couples can opt for an IVF.
You've actually laid it down quite nicely for me. So the follow-up question automatically happens to be, when should one look at consulting a specialist? Someone who is a specialist like yourself for IVF treatment. When should one consult a specialist?
See, actually, basically, it is said, as per the definition, it is said that once you have tried 1 year naturally and it's not working out for you, that is the time when you should go and consult a doctor. And if your age is more than 35 years, that is the time. But in the current scenario, we find that whenever you feel that tomorrow, maybe after 2 years, after 3 years, we may want to plan a pregnancy, it is better to get all the things corrected and checked. Because nowadays more and more things are coming, like initially it used to be age related. Now we see even the younger generation needing treatments and to go for IVF or for treatment for fertility related issues. So it is the moment you feel that yes, after so and so years I may be planning, it's always better to go and get yourself checked. You may wait, or if at all the doctor feels no, you should advance the planning, it should be, please consider it that way. Because nowadays we find that even women who are 25, 26, they are needing treatments, and even women who are like more than 35 years, they are also needing. So the paradigm, that is the curvature in which we initially used to plan that first career and then this and all used to be settled. So I feel the moment you feel that yes, this is the time I want to plan, you please try. If at all you are well within the age and everything is fine, still not working out, please approach a doctor.
So that's the question. So there is no age limit in that sense, right?
Nowadays, we usually don't say so because more and more younger generation are approaching us for treatments. And what happens is like tomorrow you may feel that no, after 35, I'll plan my pregnancy or after 4 or 5 years. There is also something called as oocyte freezing when you can preserve your fertility is also come into the picture. So if that is something that can be opted in your case, that also can be considered. The earlier it is considered, the better. So I feel that nowadays, as we plan everything, it is better that you plan this as well.
How long does this whole process take? How long does this whole treatment take, doctor?
If we are talking about IVF, it is not more than a month. Basically, we follow the cycle of a woman. We start the treatment from day 2. By day 15, she is done with the oocyte retrieval, and by day 17, she undergoes an embryo transfer. And after 12 days post that, she gets to know she's pregnant or not. So basically, it's the matter of a month.
And are there any side effects?
See, whatever IVF includes is all about hormones. So, yes, when we talk about hormones, there are side effects, but these side effects are not permanent. They are not going to stay with you. The moment you stop your injections, the moment you stop these injections, they are flushed out of your body and you can regain everything normal. If you are pregnant, then pregnancy related hormones take over. So, whatever like side effects like water retention, weight gain due to water retention, or headache, or minor side effects can be taken care of. And we are well advanced nowadays to prevent all the side effects which were earlier reported. So, practically very little side effects.
So does one need to keep in mind any of these things in terms of side effects, or now you say it's fine? I mean, it's safe enough for everybody. Is there any precondition that one needs to keep in mind or anything like that before going in for treatment? That was the last question.
Precondition as in yes, whether the injections that you are going to take, the medications you are going to take, are you sensitive to it, how you are going to react to it, that's taken care of before we start the treatment per se. And if you are already having certain medical condition like related to heart or related to any other hormonal condition that you are facing, based on that the medications and everything is modulated to bring down the side effects to as minimum as possible.
That was extremely helpful, doctor, because it clarified a lot of my doubts, and I'm sure will clarify a lot of doubts for my viewers. Thank you very, very much for your time. Thanks a lot.
Thank you so much.
Thanks.